Life Unrehearsed, brought to you by Lianas Senior Transition Support, helping you navigate home care and senior residences.
Hey, welcome back to Life Unrehearsed. Matt Del Vecchio here. And yes, girls just want to have fun and clowns want to have fun. You know, the Dr. Clown Foundation is a nonprofit organization dedicated to bringing joy and comfort to hospitalized children and elderly individuals through the use of therapeutic clowning. Professional clowns, known as Dr. Clowns, use humor and playfulness and creativity to alleviate things like stress and promote well-being and creative, positive experience for patients in hospitals and long-term care facilities and other healthcare settings. And joining us today is Melissa Holand, the co-founder, co-artistic director, and a therapeutic clown at the organization. Melissa, welcome to Life Unrehearsed.
Thank you so much.
Oh, well, you know, it's such a pleasure talking to you, Melissa. We've seen you all over the news. So glad it's been far too long. We should have had you on Life Unrehearsed many, many moons ago. And glad we're able to get the word out here. So can you tell us more about the origins and the mission of the Dr. Clown Foundation?
Sure. The Dr. Clown Foundation in Montreal started in 2002. I was lucky to have been in the right place at the right time, living in Scotland and experienced being a clown doctor there. And so when I came back to Montreal, I wanted to see if we could get an organization going. And luckily I met like-minded people and we were able to get it off the ground.
Amazing. And so going back to 2002, I love the term clown doctor, you know,
Yeah.
and so that's now 22 years and still going strong. So what specific services does the organization offer?
So we have professional therapeutic clowns, so they have training, artistic training in the art of clown, as well as psychosocial training. So being able to bring your clown character with the duo, because we always work in a duo, in the hospital setting, but also having psychosocial training so that we understand what it's like to either be in the hospital, to have different dynamics, to know from patients from different ages, the staff, the parents, and also working in long-term care, understanding what it is to have various forms of dementia and how to effectively work and provide a sense of connection and fellowship with the people that are there.
Well, you know, I'm glad you mentioned that because you talked about a hospital setting, but you could have a much different dynamic with, say, someone at a children's hospital versus a senior's residence with higher levels of dementia. And I guess, you know, the clowns have to adapt to their audience, don't they?
Absolutely, yeah. And that's a big part of our training and a lot of what we learn in the experiences that we have. For me, it's always very telling when we have families that write into us and tell us what the impact is, because for us in the moment when we knock on the door of a room in the hospital, we're really taking a chance, and we know we're just kind of showing up, and we ask, can we come in? And that's a very key element. So already the child, the parents have a chance to look at us and say, are we ready to interact with these with these clowns? And just to specify as well, our costumes are adapted to the hospital setting, so we have sort of pared down. We don't have any big makeup that you would think of like in a circus or a party clown. We just have the red nose that really identifies us as clown, and otherwise I'm dressed as a schoolgirl, there's a cowboy, there's a football player, but with a red nose and a white coat that's designed to go with the costume. So we sort of fit in with the hospital, but we don't fit in. And that's where the clown doctor element comes in. So we give patients always the chance to say no to our visit. But more often than not, it's a hard yes, a firm yes. And working with seniors, so working with children, basically work with play as being the main force behind our visit. And with seniors, it's really about the emotion, especially people with cognitive difficulties. Conversations and that sort of thing might take a back seat to physicality, to emotion, to singing, and just the delight when they're able to interact with us. just the other day, one of our clowns was describing this visit that they had at a seniors residence where there was a woman in a wheelchair and her daughter was pushing her, and they stopped and had a moment with her, and the woman reached out to touch their noses, and then she started to sing with them, and as they said goodbye, she blew them a kiss, and the daughter was in tears. Like she said, I haven't seen her react like this in so long, and to see that she still has this within her, and that it's possible to bring it out in her. She ran to the director of the center and was like, "When are they coming back? We need to have them back."
The power of the Nez Rouge. Just love that story, and a very good example of that power. Listening to Life Unrehearsed, Matt Del Vecchio here, and I'm talking with Melissa Holand, the co-founder of the Dr. Clown Foundation, about the importance of bringing joy to the most vulnerable people in our community. Now, Melissa, I've heard of La Belle Visite. So what's the difference between La Belle Visite and Dr. Clown?
So that's it. La Belle Visite is our visit in seniors' residences. So that's where our costumes are slightly different. We're dressed more like as if we were going to visit our grandparents in the 1950s. We're in our Sunday best. I wear a crinoline, a dress that when I spin, the skirt flies up. I have very nice bloomers underneath. Saddle shoes. The men wear suits and hats. And so it's sort of reminiscent of their heyday,
right?
Their first loves, first marriage, first jobs, first children, that sort of thing. So, and we all often ask their advice. That's always a fun thing to do too, to say, well, I like this one, meaning my clown partner, but he doesn't have a job. What should I do? And they're very happy to give their opinions.
Yeah, and you know, I'd love
and,
to.
Sorry, I was just going to say, and then the Dr. Clown program is for working in hospitals. So whether it be children or adults, so that's when we wear the white coat and the archetype costume.
Right. Very interesting and very smart, actually, just adapting with the different crowds and just excellent. And I could see the smiles on faces regardless of the generation and of all ages. And so I'd love to describe, or can you provide us some of the benefits that the organization has seen in the patients due to your programs?
Mm-hmm. As I said, again, it's one of the things that we delight in, is hearing from patients or their families who have experienced us. And in pediatrics, an example of one of the benefits, someone wrote in to say that their daughter was undergoing cancer treatments, and as a result was sort of kind of closed down, like she had stopped drinking, stopped eating, and she was at home and coming in for day treatments. So it got to the point where they had to bring her into the hospital because she was getting dehydrated. And when she was there, the clowns came to visit. And after this 4-day stance of shutting down and not talking and not smiling, she started to interact with the clowns. So it was like it just kind of broke the stand that she had, and helped bring her back into thinking, like, yes, you're going through a hard time right now, but it is possible to also have fun, and it's important to engage and to still be part of things.
Just an amazing story, and again, just goes to show the valuable work that you do at the Dr. Clown Foundation. We have about 30 seconds left, and I know I'd be remiss in not bringing up the role volunteers play. Melissa, can you talk about volunteers at Dr. Clown Foundation?
Sure. Just to be clear, all our clowns are paid professionals, so they're specially trained to work in the hospitals. And any action that volunteers would like to, sometimes we have events. If people want to organize events to raise money for Dr. Clown, that would be amazing. Sometimes we have little odd jobs in the office that need doing. But yeah, fundraising, I think, would probably be the main way that people can help out.
Wonderful. Good shout out to volunteers, and it's a wonderful way to contribute your time. Well, Melissa, I want to thank you for your time and sharing a little bit about the Dr. Clown Foundation. If we want to find out more, where do we go?
The fondationdrclown.ca, foundationdrclown.ca.
Wonderful. Well, thank you, Melissa. Really appreciate your time, and keep up your great work.
Well, thank you. Thanks so much for the opportunity to share it.
You're most welcome. That's Melissa Holand, the co-founder, co-artistic director, and a therapeutic clown herself at the Dr. Clown Foundation.